Many are choosing not to travel for fear of being exposed on an airplane. But if you do fly, how can you tell if your seating area is germ-free?
We swabbed and collected samples on 4 different flights. Then we sent the samples to a lab for testing. The results are troubling. The bacteria counts on Lisa Guerrero's headrest and seatbelt were in the billions. 2 out of 4 tray tables tested positive for E. coli.
AKA poop.
I don't want to go on a plane now.
This is just an example of what I carry in my bag when I travel. I actually brought an extra pack this week so that I could have them on me at all times.
Well, the world is in the middle of mass hysteria and panic for some people right now, and it all stems from a new pandemic called coronavirus or COVID-19. Now, joining the conversation is Dr. Sharkawy, an internal medicine and infectious disease specialist whose Facebook post exceeded 1.5 million shares after he called the current hysteria Panic-Demic. And joining us via Skype is social epidemiologist Melissa Jones, whose recent Facebook post also went viral after she said that face masks should not be worn by the healthy public right now. So thank you as well. You said early on that this was a panic-demic. What do you mean?
I by no means want to trivialize what's going on. But I think when fear progresses to the point where it's become pure hysteria, that becomes a panic-demic. When you see people buying face masks and hoarding them and denying healthcare institutions from having them in supply to actually look after sick patients and frontline health workers not having them, that's not a good thing. When you see people stockpiling everything possible from Costco and Home Depot and holding themselves up in their homes, thinking that somehow that's going to protect them from everything else, that's not a good thing. That's the panic-demic. We don't need to see that. What we really need to see is a more measured response and understanding that the problem starts in your own home. It starts with your own behavior from the minute you wake up to the minute you go to bed at night. What are you doing to maintain a healthy environment in your own hands and in those around you?
Yeah, and Malia, you say that people, healthy people that are wearing these face masks should be ashamed of themselves, that they're taking masks that others shouldn't need and that they don't need it at all.
What I said in my viral post was that both the CDC and WHO are recommending that healthy people not wear a face mask. We have a shortage of face masks worldwide, in part because people have been hoarding equipment like face masks. The truth is that a face mask provides a very, very small amount of protection for a healthy person in a normal risk scenario like walking through your grocery store. But a face mask is absolutely necessary for a nurse who is taking care of a COVID-19 patient.
Doctor, you say that this trade and travel restrictions are an overreaction, if I understand correctly.
I absolutely agree that you have to take some measure. I do worry about where you draw the line at some point between, cautious judgment and overkill, and you start to lose some degree of a sense of normalcy in society. Am I not allowed to go to a restaurant? Will restaurants be closed? Will movie theaters close? These are questions that are difficult to answer, but I do wonder if we are leaning towards that. And I would caution against that sort of mentality being one we have to take for granted. I think we have to take this in a stepwise approach and see what's working and see what we might not need to do in the future.
Would you go to a movie today?
I would go to a movie today. I personally, employ very strict hand hygiene. I'm generally very cognizant of who's around me, and my wife always ridicules me for being excessively cautious, and I'm an infectious disease specialist, so I'm a germaphobe by nature. The world needs to go on. The world cannot be completely crippled by what's happening here, and my fear is we're leaning towards that right now.
The thing I do, and I'm doing it right now, is I wear really stinky hand cream. It smells really strong, and it's a good reminder. So as I'm about to do this, I get this waft of tea tree oil or lavender, and I go, oh yeah, keep my hands away, because These are the lethal weapons in this epidemic. We infect ourselves by the things we touch, and then we're the ones that introduce it into our body. So there's common sense ways I think you can think about doing that without putting the supply of real masks that are needed for healthcare workers at risk.
It's a great idea, is put something on your hands that reminds you when it starts to get close to your face where you go,
There's
"Ugh."
some really bad smelling stuff.